Welcome to PharmaFanatic, the ultimate pharma guide. In this video, we are going to discuss about the topic anticholinergic drugs. These drugs are also called muscarinic receptor antagonists, atropinic drugs, or parasympathetics. Anticholinergic drugs are drugs which block action of acetylcholine on autonomic effector SAND in the CNS through muscarinic receptors. Nicotinic receptor antagonist, also referred as ganglionic blockers or neuromuscular blockers. Anticholinergic drugs are classified into natural alkaloids, semisynthetic derivatives, and synthetic compounds. Natural alkaloids are atropine and hyoscine. Semisynthetic derivatives include atropine methanitrate, homotropine, hyoscine butyl bromide, ipratropium bromide, and tiotropium bromide. Synthetic compounds are further classified into antisecretory antispasmodic agents, mydriatics, vasoconstrictives, and antiparkinsonian agents. Antisecretory antiparkinsonian drugs are again divided into quaternary compounds and tertiary amines. Quaternary compounds include propenthyline, oxyphenonium, clidinium, simtropium bromide, isopropamide, glycopyrrolate. Tertiary amines include dicyclomine, valethamate, pyrazipine. Mydriatics include cyclopenolate, and tropicamide. Vasoconstrictive agents are oxybutynin, flavoxate, tolterodine, darifnacin, sulfnacin. Antiparkinsonian drugs are trihexyphenidyl, procyclidine, biparidine. Other classes of drugs producing antimuscarinic actions are tricyclic antidepressants, phenothiazine, antihistamine, disopyramide. So now let's dive into pharmacological action of anticholinergic drugs. Atropine is the prototype drug, and prominent effects are seen in organs with parasympathetic tone. Atropinic effects are mainly produced in organs such as CNS, CVS, eye, smooth muscles, glands, body temperature, local anesthetics. Now, what effects did atropine have in CNS? Atropine at high doses produces CNS stimulant action, but in case of low doses, it produces peripheral effects. Hyoscine produces central effects even in low doses. Atropine stimulate medullary centers such as vagal, respiratory, and vasomotor centers. It depresses vestibular excitation and antimotion sickness property. It blocks cholinergic overactivity in basal ganglia, thereby suppresses tremor and rigidity of Parkinsonism. In high doses, atropine can also cause cortical excitation, restlessness, disorientation, hallucinations, and delirium, followed by respiratory depression and coma. In cardiovascular system, atropine produces its effect on heart and blood pressure. In heart, it produces tachycardia. It decreases heart rate by blockade of M2 receptors on SN node. On intramuscular and subcutaneous injection, initial bradycardia occurs. Atropine abbreviates refractory period of a V node, which facilitates a V conduction, further PR interval shortened. Tachycardia and vasomotor stimulation causes rise in BP. Histamine release and direct vasodilator action causes low BP. An eye topical instillation of atropine causes mydriasis, ablation of light reflex, and cycloplegia, which lasts for 7 to 10 days. It causes photophobia and blurring of vision, and rise in intraocular tension causes narrow angle glaucoma. In smooth muscles, parasympathetic muscles gets relaxed. Constipation occur due to reduction in tone and amplitude of contraction of stomach and intestine. COPD and asthmatic patients are more susceptible to bronchodilation. Relaxant effects are observed in ureter and urinary bladder, which causes urinary retention in older males, along with prostatic hypertrophy. In glands, due to blockade of M2 receptors, atropine markedly decreases salivary, tracheobronchial, and lacrimal secretion. Skin and eyes become dry, talking and swallowing difficult occurs. It also decreases secretion of acid, pepsin, and mucus in the stomach. High doses of atropine causes rise in body temperature. Due to inhibition of sweating and stimulation of hypothalamus causes rise in body temperature. Atropine produces local anesthetic action in cornea. When coming to pharmacokinetics of anticholinergic drugs, atropine and hyoscine rapidly absorbed from gut. 50% of atropine is metabolized in liver, and rest excreted unchanged in urine. T-half is found to be 3 to 4 hours, and hyoscine have better BBB penetration. In case of quaternary compounds, they have incomplete oral absorption, that is 10 to 30%. Central and ocular effects are not seen after oral or parenteral administration due to poor penetration in brain and eye. Elimination is generally slower. They have higher nicotinic blocking property, which causes postural hypotension and impotence as additional side effects. At high doses, some degree of neuromuscular blockade may also occur. In case of hyoscine butyl bromide, 2040 mg oral or intramuscular or subcutaneous or intravenous administration, less potency and longer activity than atropine. It is mainly used for esophageal and gastrointestinal spastic conditions. Atropine methanitrate 25 to 10 mg intramuscular injection is used for abdominal pain and hyperacidity. Atropinic drugs are mainly used as antisecretory, antispasmodic, bronchial asthma, asthmatic bronchitis, COPD, as mydriatic and cycloplegic, as cardiac vagolytic, for central action and to antagonize muscarinic effects of drugs and poisons. Side effects and toxicity include dry mouth, difficulty in swallowing and talking. Dry, flushed, and hot skin, especially over neck and face, fever, difficulty in micturition, decreased bowel sounds. A scarlet rash may appear. Dilated pupil, photophobia, blurring of near vision, palpitation. Excitement, psychotic behavior, ataxia, delirium, dreadful visual hallucinations. Diagnosis of atropinic toxicity is done by subcutaneous injection of methacholine 5 mg or neostigmine 1 mg fails to induce typical muscarinic effects. Drug interactions include atropine delays gastric emptying, thereby reducing absorption of many drugs. On other hand, digoxin and tetracycline absorption increased. Antacids interfere with absorption of anticholinergic drugs. MAO inhibitors interfere with metabolism of anticholinergic antiparkinsonian drugs, therefore delirium occurs. Thank you for watching the video. Like, share, and subscribe Pharma Fanatic for more pharma-related content.